Hello everyone, I am Dr. Nihal Devkar, a periodontist and implantologist. Many patients do come to us with the complaint of dark gums. In these scenarios, there are a variety of reasons for excessive pigmentation of the gums. So in today's presentation, we are going to discuss different etiology or reasons behind dark pigmentation and few treatment modalities to correct this heavy pigmentation. So let's start with the topic on gingival depigmentation.
Although theoretically the color of the gingiva is described as coral pink, but in many cases this color varies from mild to moderate pigmentation, the main cause being melanin deposits. The concern of patients with these heavy pigmentation is black gums or dark gums, and their main demand is aesthetic improvement, especially in the anterior or front area. Melanocytes, as we all know, reside in the basal layer of gingival epithelium, and they produce melanin in response to various stimuli leading to pigmentation. There can be certain influences like genetic predisposition that can affect the degree of pigmentation, or environmental influences like UV exposure, trauma, and inflammation. Apart from this normal physiological pigmentation, there can be excessive pigmentation due to certain pathologies like Addison's disease, Peutz-Jeghers, or smoker's melanosis, or certain exogenous factors like amalgam tattoo or drug-induced. What are various options to correct this gingival pigmentation? First, scalpel. Second, burr abrasion. Next, we have electrosurgery, cryosurgery, certain chemical agents like phenol and alcohol, or lasers like diode, RBM yak. Amongst these, the scalpel technique is one of the most commonly used technique. The procedure being, we use a simple 15 number blade for removal of epithelium or a thin layer of connective tissue. The healing happens by secondary incision. The advantages are it's cost effective, simple, while the disadvantages can be it can cause some post-operative bleeding and discomfort. Compared to this, the laser depigmentation has advantages of being precise, causes minimal bleeding, and has better patient comfort. Variety of lasers, especially soft tissue lasers, are used like diode, CO2, ND-YAG, and RBM YAG. The healing after gingival depigmentation procedure takes typically 1 to 2 weeks depending on the technique used. There is some kind of recurrence and it varies from case to case, takes somewhere around few months to years, and it is basically due to melanocyte migration and activity. There is a lot of literature available on this topic of gingival depigmentation. For example, Damet first described melanin pigmentation in gingiva. Nakamura showed faster healing with lasers. Perlmutter showed that the recurrence rate differs across techniques, while recent studies have shown that lasers are better as far as patient's comfort is concerned. So now let's go straight away to our clinical case where patient complains of dark pigmented gingiva, especially with maxillary and mandibular anterior areas. We have 15 number blade, Gracie curettes, and other instruments ready for the procedure. So we give the infiltration anesthesia over the sites that we are going to operate for gingival depigmentation. So here is number 15 blade with which we can either mark the area or straight away start with the deepithelialization process. First on the right side and then on the left side. We can use the peeling method in this manner, or you can also use the rotary burrs and use it cautiously to remove epithelium and very little part of the connective tissue. Some remaining part can be removed using Gracie curettes. Now we turn towards left side. Using the 15 number blade again, we mark the sides, ensure that all areas of the dark pigments are covered and depigmentation is done over those areas. using 15 number blade over the entire left side from maxillary central incisors towards the premolar. Again, doing the final cleanup using gray curates. Once that is done, to control the bleeding, we have kept the hemostatic collagen ready, which is available in the form of Hemocol here. We take out the required quantity prior to the procedure, and after the pigmentation procedure, we apply this hemostatic collagen over the marginal and attached gingival portion that is deepithelialized for control of any oozing. We can leave the hemostatic collagen onto the gingiva before discharging the patient, or we can cover it using a periodontal dressing or periodontal pack. In this case, we have given a co-pack on top of the marginal and attached gingiva.
Thank you for joining me in today's session on gingival depigmentation. Hope you had some understanding on gingival pigmentation, etiology behind dark gingival pigmentation, and some treatment modalities to correct this pigmentation using either scalpel or lasers. If you found this helpful, do like and subscribe to our YouTube channel of Regeneration Hub Pune, and to receive more evidence-based information in future about periodontology, implants, and more specifically on hard and soft tissue augmentation around teeth and implants. So keep learning, keep growing, and keep giving more confident smiles to your patients.
At Regeneration Hub Pune, we train dental professionals for variety of workshops like basic implantology workshop as well as advanced workshops like immediate implants, hard and soft tissue augmentation workshops, and exclusive root coverage and soft tissue workshops. Do reach out to us on the number that is given